Hello, everybody. Welcome. Well, thank you very much today for joining us. We've once again enjoying some of the technical issues with the wonderful internet we've got. I just want to double check that it's all working, and then we can proceed. I hope you're all enjoying your current situation as far as managing through this particular challenge that we all have. And I am just conscious of the fact that I know this is a very strange and interesting time, and for a lot of us, we are in a position where we are dealing with day-to-day information and changes, and it is a very difficult situation to navigate. I think we're very understanding and sympathetic of that. And really, the purpose of today's presentation was to have a discussion around some of the scenarios that may occur in your practice and physically what you can do for them. So I'm just conscious of doing that. So I'll get this going for you in a second. So I think that the key is that what we're focused really on is the scenarios that come before us. Now, the key thing here is, I need to be honest, is that there's a lot of information from different sources. So we operate 9 medical centres, or skin cancer practices specifically, and like you, we're trying to disseminate the information from medico-legal, the government, the state health authorities, and the other experts in being able to manage through this particular challenge. So what we've done here is put together, I suppose, what we've been able to disseminate and what we're doing in our practices. I mean, there is unfortunately no sort of blueprint, obviously the RACGP, there's other sources of information which we've drawn upon. But I also just want to reflect upon the fact this stuff is changing daily. So what I'm going to do is give you the presentation based on what we're doing with relation to this and just go through that. So, I mean, I think the key thing we all know, there's a lot of confusion, particularly with our staff, but also with our doctors. I mean, interesting with us, probably the doctors can be as confused as the staff. And what we want to do is navigate through what are the facts so that we understand what's going on. So in the first instance, we're in a situation of what we want to do is define what is close contact. So, because this is very, very important to determine whether we do or don't need to do something with relation to a patient or a staff member or a doctor that's come in contact with somebody. We then obviously have to define what is casual contacts, and then we're going to go through some various scenarios and what actions we would take if they were to occur. So we'll just go through those. Now, basically, close contact is this. So we're going to be clear about this. Someone is in close contact that's spending greater than 15 minutes face-to-face contact in a setting and with a confirmed case within 24 hours. Now, close contact is like this. Close contact isn't sitting, obviously, necessarily next to somebody. It's one of those things, as you know, the research, published research is changing constantly. But effectively, what we're talking about is 15 minutes of close contact. This is why the government is, with some of the social isolation or distancing measures they're putting, is closing down certain businesses where people do spend a lot of time face to face. So nail technicians and nail salons spend a lot of time face to face with people, hence why the government doesn't want that to be going at the moment, as we're trying to stem, obviously, the spread of the virus. And the other way is that sharing closed spaces for prolonged periods of time. So, for example, the reason not holding meetings in businesses because obviously people spend a long period of time in a closed space. But typically within our practices, we're not spending 2 hours, in a closed space with each other. We're coming in and out the rooms. The people are changing as part of that process. So that's what close contact is defined as, and that's from Avant. There's the definition of close contact. And casual contact is everything else, right? So it's really only close contact that we need to be mindful of as what the implications it has for us. Now, we're going to go through some different scenarios and basically talk about how they should be managed. Now, if a doctor or staff member has flu-like symptoms, so, I mean, the problem we're going to have is people are going to feel unwell, right? We're coming into the flu season or, the cold season, so people are going to feel unwell. So if a doctor or staff member is feeling unwell, we basically reschedule their patients and we ask them not to attend the practice. So, yep, please stay at home until you get better. And what we know from the virus is either people are going to go home and have their flu-like symptoms and then obviously going to get better, or they're potentially going to get worse, and that's at the point that we need to look at what other interventions we've got. And from the staff's perspective, is we will basically ask them to take sick leave until the symptoms resolve. So, I mean, that's pretty simple to understand. So, not well, please stay away. Okay, patients who have flu-like symptoms who attended this centre, these are patients that have turned up. Now, what we've been doing in our practices for over the last 2 or 3 weeks is temperature checking patients on arrival. Once again, I live in Singapore, and one of the things that I've learned is very quickly in the piece, they started temperature testing everybody that was walking the door to help a couple of things. One is to identify people that are obviously running a fever, but secondarily, it also helps our other patients coming into the practice have the comfort that there are people, as I said, with fevers effectively within the clinic itself. We need to basically contact the patient in advance. So to basically say, if you are not well, they shouldn't cancel, they shouldn't come into the practice at all. And obviously look to reschedule their appointment. So if someone says, I'm not feeling well, we basically just look, can we reschedule your appointment into the future? So it's an important thing to do to make sure that people who do have flu-like symptoms. Now, obviously as a general practice, that is very difficult because you're going to have people that present with flu-like symptoms. This is obviously some of the actions we're taking with relation to our, our skin cancer practices. Now, when a staff member confirms an appointment, and they find out the patient does have flu-like symptoms, so we are obviously ringing our patients in advance, we're basically rescheduling their appointment and ask when they're symptom-free. Now, scenario 4 is around a staff member or doctor who's come in contact with a positive patient, or a patient visits a centre that's later diagnosed with COVID. So if obviously the doctor or staff comes in close, would obviously require them to, and that's once again, close contact. So go back to that definition of close contact, would be required to isolate themselves. We basically would get any of the admin staff that obviously were, had come in contact. We could set them up to work from home. We'll talk about how you can do that in a moment, and give them remote access, because for the most part, these people could still work if you needed the workforce. I mean, most practices don't have lots of people on call, so if you were to lose a percentage of your staff, they would be able to attend. One of the other things that we've done in our practices is we've tried to group our staff, particularly in shifts. So in other words, have a shift. So if there was a situation that we did have a positive situation, we would only knock out a percentage of our workforce, not the entire workforce as such. So we're not necessarily getting everyone to work across all 5 days. And the key thing is you need to follow the instructions of the local Department of Health. So if someone has tested positive, once again, there is very clear instructions on how this is to be managed, and you just need to get in contact with them. And once again, as you know, these things are fluid, so that's why you need to be in contact. Now, if the doctor's been diagnosed and has been at work in the past 14 days, basically we need to take these particular actions, and I'll just pull them all up. So the first thing you do is you need to contact the Department of Health and follow their instructions. So I think that the key thing is we need to determine whether, what actions we need to take. Is it cleaning? Is it sterilising? Is it sufficient? Once again, what close contact has that doctor had with other workers? If they have been obviously in close contact with particular people, they might need to be required to self-isolate. And what we're trying to do here is, let's say for the example that the doctor obviously, is not going to be able to come to work, is that we will be able to manage that a little bit later. So just 1 second. All right, sorry, okay. So the front desk obviously should reschedule these patients for 14 days. So typically if we've had a situation, the doctor's been diagnosed. As you know, there's been some doctors that have come back from overseas holidays. For the most part, they would have probably gone through their self-isolation. So in those situations where we've had doctors come back, we've then obviously gone to organise them to be in self-isolation and just reschedule their appointments into the future. Now, some practices that's easy to do, some practice that's hard. I mean, general practice, there's obviously people are presenting because they've got, concerns immediately. There are other patients which are, coming back for recalls or for other situations which you can obviously defer that. Now, if we have a situation where a staff member is tested positive, basically, once again, follow the same instructions. We then obviously need to look who they've been in close contact with, and the staff member will be going on sick leave for 14 days. So, that is basically the steps that you need to take. And we need to review, as I said, whether the staff member, as you know, 80% of the people that will get the COVID virus will have mild, obviously a mild impact of it. So they might be able to, once again, as they're in self-isolation, still be able to provide you support in confirming a patient's recalls or other services. So we're set up so that if a staff member was to do that, we can provide them with a laptop and other resources. Okay, so let's say, for example, we then lose staff and we need to operate at reduced staff levels. So this is, we're talking about nursing. So in most practices, you've got receptionists and nurses. So we're just going to talk about those two different situations. So if we basically, are in a position we lose our nurses, we obviously want to keep communicating with them. If you're in a practice where the nurses are doing or assisting in certain things, so let's say, for example, assisting in doing procedures or the like, what we can do is firstly, we need to probably make sure the doctors are aware they need to be a little bit more self-sufficient. So where they maybe have needed the nurse or had a nurse, maybe it might be a position where they need to sort of help do that themselves. The other one is you can convert those sessions, obviously, to consult sessions, and then try and catch it up in the future. So when we do have the nursing staff back, we can do that. It really is dependent per practice. It's such a hard thing to pick. You may have some reserves on the bench. I mean, it's always nice to have, not that most practices have that. I mean, we do as a resource, but as I said, to fill those gaps. And then if we're in a situation where we're losing staff, so we need to cooperate, to operate on reduced staff levels, there's not enough reception staff, these are sort of actions, once again, we were taking. So I think there's certain roles that, a reception staff member does that might be able to be taken home. So, once again, contacting patients the day before. I mean, look, practices can communicate with patients in different ways. There's obviously, we can send them SMSs and saying, hey, if you've got these particular situations, please don't come in. Or once again, you could be doing it via the phone. So obviously phone-based work could be done from home. We could also get nurses to try and cover. I mean, I suppose the challenge we have at the moment, we're in a war-like environment where everyone needs to step up and help each other. So, it might be the case that, nurses do need to learn how to use your EMR software from a practice management perspective. Conversely, you may also need to get some of your reception staff to understand, how to help set up trays or these sorts of things, depending on what's your situation. You might have some other staff you might be able to deploy, and you can also, divert calls elsewhere. So there's different resources. Now, let's say the schools are closed. Now, as we're aware, the government is advising they don't want schools to close, and this is because, what they're finding, obviously, as far as transmission is concerned, is that, well, from once again the available elements, that they're not the problem so much. It's more actually the younger adults, or some the teenagers and then older younger adults that are probably more the issue. So there's resistance, but as we know, most schools are being shut or having holidays being brought forward or the like. I know my kids' school is all now 100% online as of today. So the problem is for us is if the school's shut, percentage of our workforce have kids. So, the key thing is, well, if we did lose them, could we once again be in a position that we operate with limited staff, give them deployed resources to be able to access remotely? I mean, most companies, IT companies will be able to support you with that. The other thing that we've looked at is obviously creating a creche. So if it was a situation where the schools were shut and we really did need to help out, could we once again find somebody who's got a blue card who could look after the children? I mean, once again, not ideal, but it's something we have to do in these sort of strange and interesting times. The other thing, obviously, to note, sorry, just with relation to schools, is that all of the advice we've seen and what's coming out, obviously, state by state, is that they will still provide at a school level childcare for healthcare workers. So it shouldn't really be a problem you have to deal with. But, we have to just look at, obviously, all of these different options or scenarios. So one of the things we've seen in some countries is, patients over the age of 70 being required to self-isolate. This is obviously a high-risk population. I mean, we're hoping we won't see that in Australia. We've obviously seen it elsewhere. But look, I think the key thing is that if it is the case, if it's obviously an appointment that could be delayed, that was they're just in our appointment book for a regular follow-up or otherwise, we'll just need to obviously delay that until they can come back in. And the other one is that if you do have those gaps created, there are probably other patients who may be in your system, once again, for follow-up or other routine examinations that might be able to bring forward to help fill those gaps. I mean, it's sort of interesting for me at the moment, talking to a lot of practice owners. I mean, I would have expected the practices would be very, very busy at this time. I mean, a lot of practices are sort of sharing with me, they're actually not as busy as they had been previously. So a lot of patients are considering to stay away, which is obviously a bit of a concern. Now, one of the things that we are seeing, definitely in our practice, we're seeing patients cancel because they're concerned about, obviously, the virus. I mean, there's probably a couple of things in here. One is I'm concerned about coming to the clinic and I might, get an infection. The other one is obviously I've lost my job. I mean, there's, once again, there's a lot of chaos, a lot of people that have very quickly, abruptly had their world changed. So what we've done is we've developed a new script. So to let the patient know, so if a patient rings up and says, look, I want to cancel my appointment, the first thing we're doing is reassuring them that we are a safe place to come, okay? We've got certain measures in place. So in our practice, we've got temperature testing, obviously hand sanitizer, the social distancing, so the waiting room chairs are spread apart. One of the other things we're doing is if patients want to wait in their car and we can contact them when they need to come in rather than sitting in the waiting room. So there's measures that we can put in place to say, look, we are a safe place to come. And there is going to be concerns in the population because they're scared and confused as to what is a safe place or not. And one of the challenges of the medical practice is we do have sick people come in the door, and people are going to be concerned that I'm coming into an environment where I might get infected because I'm there. But if you can make it very clear that we've got all these protection measures in place, once again, you and your staff are safe. In our practices also, we've set up a roster where every hour we are cleaning every common surface. So counters, door handles, door jabs and frames, all of those surfaces. So if we can, give the patients the comfort that we are doing everything that's humanly possible, maybe that will give them the comfort because we don't want them to cancel their appointments if they really need to. So the other thing that we're doing as a business as well is tracking the cancellation rate. So for us, we want to be in a position where we've got we know how many patients are cancelling. So for example, in our practices, we had a level of cancellations last week. We had a spike on Monday. It's now dropping back off. But the fact is there are patients that are cancelling who are normally in there. And we're tracking it because we need to understand what's the human resource requirement we're going to need next week or the week after based on what's going on. Now, we don't know what's going to happen next if the government is going to lock society down further. I mean, that is a potential risk. But the fact is your practice will always be open. The problem we've got is, are patients going to want to come into the clinical centre? And I think we need to do everything we can to reassure them. Now, of course, we see that there's a cancellation of patients and suddenly we've got people standing around with nothing to do. We might need to reduce the availability. Now, once again, different practices are different. So, if we're a skin cancer practice, if we lost 20% of our patients, then we would probably look to operate 4 days a week as opposed to 5. In a general practice, that's obviously a very different situation, but we are just conscious of, we're still trying to manage a business, right? I mean, ultimately, if we have a fall in income, but we don't change our expense bases, then our business is going to be put at risk, and we don't want to do that, right? Now, hopefully this is a short-term situation, right? I mean, obviously the Prime Minister is telling us it could be up to 6 months. I mean, if you look at the available evidence, it's probably more like 12 weeks, 13 weeks, but it's going to be highly disruptive in the short term. And like, as any business, you need to manage your cost base and what's going on, because as I said, otherwise, for some businesses, you could be in trouble. The other thing that we're doing is we can look at probably the point here is around telemedicine. We're conscious of the fact that we will soon be able to offer telemedicine services to our patients. So if I am cancelling, so Mrs. Jones is very sorry to want to come in, could we offer you as a teleconsultation as an alternative? Now, we're organising to put together a webinar specifically on this, which will walk through, once again, a model of what, how we're going to be managing and deploying it. There's plenty of other providers of this information. It's obviously great that we're now getting, telehealth item numbers from the government. I think, we've got the genie coming out of the bottle. It'll be very hard to push it back. And maybe once again, this is, maybe one of the good out of this particular situation is that whole integration and being able to have a relationship with our patients, via telemedicine, will become, one of those standards. So, if patients don't want to come in, we can provide a solution to them. And I think that, as I said, if we've got patients and they can't get them in, we can bring their appointment forward. So as we're seeing patients cancel, we're bringing patients that are booked in further forward. And the other one really is here is educating the staff around reducing anxiety. So we've tried to do the best we can. Bear in mind, we're all trying to move very quickly. Is creating the scripts, once again, sitting down and talking with them, and because part of it is if our staff feel comfortable and in control, then that will come across on the phone, which will give then patients comfort as to exactly what is going on. Okay. Now, one of the things we've got, as we know, is there's a large number of people that suddenly have no income other than the New Start allowance. So, thankfully the government's made that easy to access, but the fact is there's a lot of people who've gone from whatever dollars they were on down to, $550 a week. So, I mean, our practices are private billing practices. I mean, we do a little bit of, mixed billing, but we're just conscious of what do we do if patients say, look, I want to come in, but I've got basically no money. I mean, the key thing probably here is to negotiate with your doctors of can we be flexible at this time. So I suppose what we're doing is we're not putting a sign on the front door saying we're now a bulk clinic. What we're going to do is say that if a patient rings up and says, look, I'd like to come in, but I basically don't have any money, we could look and say, well, on this occasion, we can bulk bill you. And hopefully, once again, still keep patients in our system and keep our business going forward. But, in the short term, obviously, having to take the bulk bill fee. Now, probably the most drastic measure would be obviously the country's put in lockdown. Now, we will never be required to close our centre. I think what the issue here is, look, we may. I mean, it's not completely unreasonable, but I think the practices would be the last thing on the planet that would be shut. So all of the instructions are that we need to stay open. We will remain to stay open. I mean, if you look at the businesses that the government has currently, or facilities the government has shut down, it is basically places where people congregate in large numbers in close proximity. That's what it is. It's one of those things is that certain businesses, but I'm just conscious of the fact that it's a combination of what the government's doing, but then also what the media is telling people. So, everyone's in, what's an essential service? There's no definition of essential service. There are facilities which the government doesn't think should operate. I am just conscious of the fact that a lot of this is the psychology of our patients, the information they're being fed, whether it's through the mainstream media, but particularly social media, which is obviously having a large impact on the psychology of our patients. Now, if we had to lock down in that situation and we couldn't operate for whatever reason or in a very limited capacity, we could get our practice managers to work from home. We could remote access and obviously divert the numbers. And we could then work with the doctors to say, right, well, we can reopen or get back to business as usual. Can we do some additional hours or sessions? Because I'm looking at this, of course, from a business perspective, is that we could probably take a hit on income for a short period of time, but can we try and make up those dollars later? I mean, one of the challenges we're going to have is, if we did have reduced, income, are the landlords going to, help manage our wages or sorry, our rent bills? So these sort of considerations. So I suppose I'm just conscious of, can we defer some of this work to later so that we can maybe pick up the income? Now, most doctors, as you know, are subcontractors. So if for some reason they're not able to work or not work at their capacity, they're probably going to be interested in trying to pick that up later as far as income is concerned. And, once again, we can obviously contact our patients and reschedule them. If there was that situation, I'm just conscious of what we want to do is try and defer them a little bit later and try and, as I said, pick that up later. Okay, that's the sort of the run through of scenarios. I mean, there are many others, but they're sort of the most common ones that we've looked at, spoken to the relevant authorities and come up with some solutions to that at this point in time. Now, if you do have any further questions, you are more than welcome to submit them to myself. I think also that if you have other questions related to any other areas of business. I will tell you about what we're going to be doing next in a moment as far as the next presentation. I am conscious of the fact that this is a very challenging time for all of us, and that we are in a position where we need to be taking action very quickly. So we've organised every Monday for Professor David Wilkinson to do an update on what's going on with the virus and what the government's doing and what measures and what we can see on the horizon. So I definitely encourage you to see that. That's at 7 o'clock Eastern Time on Mondays, and the recording will be made available of it. And then every week I'm going to be having something that's business related to help push that process forward. Next Thursday, I'm very happy to let you know we've got a gentleman by the name of Alan Miltz. Now, Alan Miltz is the global guru on managing cash flow. He's world leader, happy to be an Australian, actually a South African that lives in Australia for the last 20 years. He's got an extraordinary presentation on how to managing cash flow in a time of crisis. So if you do see your income drop and then you're trying to manage cash flow, it can be quite difficult. And for a lot of us, I'm certainly no financial whiz. I look at Excel spreadsheets and they put me to sleep. But he's got this fantastic tool. It's a web-based software. You can put in 6 numbers and it will project your cash flow out. So he's going to be doing a presentation this time next week, which is basically talking about how you manage your business when cash does get tight, and then also how to use the tool so you can use it for your practice going forward. Excellent. So I'm just going to see if there's any other information. Look, I think that once again, we're very conscious of the fact that this is very, very challenging for all of us. So, we're here to support you. I mean, hopefully, please be aware of that. You're more than welcome to contact me later so that we can, once again, share this. The video or this recording will be shared back with you so you can share it with your staff and your colleagues. We actually also have a document which actually puts all the full words out. Basically, it was the situation, the impact on the practice, and the actions we would take. If I was to put that on a screen, it would be too hard to read, hence why I sort of gave you the abridged version. So we will share that with you later. But as I said, these are challenging times, but we're in this together, and I know that if we help support each other through it, we'll get through this. So once again, stay positive, and I look forward to speaking to you next week.